Hello, and welcome to Healthcare Matters, where the medical and legal communities come together to discuss healthcare matters. I'm your host, Mike Matray, and today's guest is Troy Bundy. Mr. Bundy is a hiring partner at Hart Wagner in Portland, Oregon, where he has been defending healthcare professionals since he joined the firm in 1996. Welcome to the show, Troy.
Thanks, good to be here.
A relatively recent phenomenon in healthcare delivery has been the expanding availability of healthcare services in America's big box retail stores. CVS recently purchased Target's in-store health clinics, making it the largest retail healthcare clinic chain. How do liability risks differ in these big box retailers as opposed to a doctor's office? And how would you recommend these new healthcare delivery sites mitigate their risks?
Well, as far as an evaluation of how the risks differ, I would have to say that there's no difference in a big box retailer clinic as opposed to a regular standalone clinic as far as the standard of care is concerned. So the reality is there are not differing standards of care for a clinic versus a standalone clinic versus one that's in one of these retailers. The risks are that the staff will pretend as though the standard of care is different. But I think in reality, I've personally never seen that occur. I myself have gone to an ophthalmologist, for instance, as in Costco, and I use them. Examinations are the same, everything's the same. But I think that there could be a potential risk that the services are not treated as though they are within a standalone clinic. The reality is you need to, if you are operating a standalone clinic, you need to follow protocol, appropriate charting, EMR, and refer patients when you need to. If there's any suggestion that a referral is indicated, it needs to occur. The other risk is, I think, from a patient perspective, they may or may not treat the visit as though they were going to a formal physician's office or clinic setting. And so it's going to be important for the clinician to, probably dig a little bit deeper in determining what problems or complaints the patient has that's bringing them to the clinic that particular day.
Well, Troy, I'd like to thank you for coming on Healthcare Matters today. It was wonderful to have you as a guest, and I hope you'll come on again soon.
Thanks.
One of the major differences is I too have been to a retail health clinic, and it was a nurse practitioner, a physician's assistant, and there was no actual MD or OD on site. And one of the things I noticed would be that what if a more pressing health matter is discovered in the retail clinic? How would they note in the electronic health record or the traditional medical record that they referred the patient to an actual MD or a cardiologist? And how would that stand up in court?